Hi, this is Aisha, and welcome to this video about chemotherapy and blood counts. In this video, you will learn about the effect chemotherapy has on your child's blood counts, how to spot signs that their blood count is low, and what can be done about low blood counts. After watching this video, we hope you will understand which of your child's symptoms can be caused by a low blood count. We also hope that the information will help you spot signs of when your child's blood counts may be low and know what can be done to help. Cancer involves rapid and uncontrolled dividing of cells. Many types of cancer can be treated with chemotherapy, which is an anti-cancer medication. Unfortunately, the chemotherapy cannot tell the difference between cancer cells and healthy cells, and so affects all rapidly dividing cells. This leads to many of the side effects that you may have heard about already, including hair loss and mouth ulcers. Red blood cells, white blood cells, and platelets are made in the bone marrow and are rapidly dividing cells. Your child is therefore likely to develop low blood counts during their treatment. We can find out what your child's blood count levels are by taking a blood test called a full blood count, or an FBC. Red blood cells. Hemoglobin, or HB, is a protein found in red blood cells. It carries oxygen around the body. A normal level of hemoglobin is usually around 110 to 130. If your child has a low hemoglobin level, they might develop some of the following symptoms: tiredness and lack of energy, look pale, breathlessness, feeling cold, feeling dizzy, headaches, poor feeding or appetite. If levels of hemoglobin drop to 70 or lower, your child will usually receive a blood transfusion. However, some children will have a different cutoff level depending on their treatment, such as radiotherapy. Sometimes children develop many symptoms of a low hemoglobin before their levels fall to 70. If you notice this in your child, please speak with their key worker or doctor. White blood cells. When the levels of white blood cells are low, the risk of infection is highest and your child will be less able to fight infection. The only way to tell if your child's white blood cell levels are low is to take a blood test. There are different types of white blood cells. The most important white blood cell during your child's treatment is called a neutrophil. Neutrophils fight bacterial infections. The normal level of neutrophils is 1.5 to 6. A low level of neutrophils is 0.5 or lower. When your child's neutrophils are 0.5 or lower, this is called neutropenia. You may hear the doctors and nurses say your child is neutropenic. When your child is neutropenic, it is important that they receive antibiotics if they develop a high temperature or are unwell. You will hear more about this in a separate video. Most of the time, we wait for your child's level of white blood cells, including neutrophils, to recover by themselves. However, some children may need a boost to help them recover more quickly. This might be because they are due more chemotherapy and cannot wait for them to recover naturally, or they might be unwell with an infection. In these situations, a medication called GCSF can be given. GCSF stimulates the bone marrow to make more neutrophils. If your child needs to receive this, your child's nurse or doctor will talk with you about it. Platelets. Platelets are a type of blood cell that help the blood to clot. They therefore help to stop bleeding and help to heal wounds. A normal platelet count is between 150 to 400. If your child has a low platelet count, they might have the following symptoms. They may bruise more easily, have nosebleeds, have some bleeding gums, small bleeds under the skin. This is called petechiae, and it can look like clusters of red tiny pinprick dots. If your child's level of platelets is low, they may need a platelet transfusion. It will depend on a number of factors. Generally, platelets can fall to about 10 before a transfusion is given. However, if your child has symptoms of low platelets, such as bleeding, they may need a transfusion before this. If your child is due to have a lumbar puncture, their platelets will need to be above 20. If your child has a brain tumor, their platelet level will need to be kept at 30 or above. If your child is having radiation to their spine, their platelets will need to be kept at 50 or above. If you are unsure what your child's platelet levels should be kept above, please speak with their key worker or doctor. The three main types of blood cells, red blood cells, white blood cells, and platelets, described above, will be monitored closely during your child's treatment. If your child has a central line, such as a porticare, the blood samples can be taken using this. If your child is in hospital, either at Great Ormond Street or at their shared care hospital, the blood samples will be taken there. If your child is at home, a community nurse can come to your home to take the sample. Blood tests will be taken at least once a week as per your child's shared care hospital and Great Ormond Street Hospital will both be aware of the results. This is so that shared decision can be made in place regarding any actions needed for your child, and all teams are kept informed and up to date.